Welcome to the Daily Health Hack, your source for quick and effective tips to boost your well-being. In just 10 minutes each day, we'll share simple hacks for nutrition, fitness, and mental wellness. Join us to empower your health journey. Let's dive into today's hack.
Okay, so red light therapy, it's everywhere, right?
Yeah, it really seems like it.
Spas, gyms, you can even buy gadgets online.
Yeah, even for like a quick mood boost now.
It's like red light is the answer to every problem.
Yeah.
But is it really? Like, is this a miracle cure or is it just hype?
Yeah.
And to help us figure that out today, we have our expert. I'm really curious, are we all like getting fooled by marketing here?
Well, it's definitely having a moment right now.
Yeah.
And it's understandable why people might be a little skeptical.
Yeah.
But what's interesting is that red light therapy, it's not actually new.
Oh, really?
Yeah. Researchers have been looking into this for decades. It's just recently that everyone's kind of like gotten interested again, both, scientists and just like regular people.
Okay, interesting. So before we get to all the studies and the details, can you just give us like a crash course on how this whole thing even works? Because we're talking about shining light on our bodies.
Right.
It seems kind of out there.
Yeah, so it comes down to wavelengths, specific wavelengths of red and near-infrared light. So these wavelengths, they can actually get through our skin and get to the mitochondria.
Like mitochondria, those are the little energy factories inside our cells, right?
Exactly. Think of your cells like, well, they are tiny little factories. And the mitochondria, they're the power plants keeping everything running.
Okay.
And so red light therapy, what it does is it's almost like giving those power plants an upgrade, a more efficient energy source.
Interesting.
And the idea is that this boost of energy, it creates all these good effects throughout your body. So less inflammation, more collagen production, things like that.
Okay, so that makes sense. But a cascade of positive effects, that sounds really impressive. Like, what does that actually look like? Can we break that down a bit?
Sure, yeah.
And maybe we can start with skin health, because I know that's an area where we've seen a lot of research on red light therapy.
Yeah, that's where the research is probably the strongest. It's everything from wrinkles to acne, even helping wounds heal faster. For example, there was this study, they found that red light therapy could actually boost collagen in the skin, which is a big deal because, well, collagen is what keeps our skin looking, young.
So it's like, instead of just putting creams on, you're going right to the source, getting your skin to make more collagen naturally.
Exactly.
Yeah. Wow, that's really interesting. And I know it's not just wrinkles. You mentioned acne. There are other skin conditions, too, that it could potentially help with.
Yeah, for sure. So red light therapy, it can actually reduce inflammation. And inflammation, that's a big part of what causes acne.
Okay.
And it can also help those wounds heal faster, like we were talking about.
Now, speaking of healing, I also read about red light therapy being used for pain. Specifically, I saw stuff about joint pain. What's going on there?
Right. So that's another really promising area of research, especially for osteoarthritis. And we're not just talking about people saying, oh, I feel a little better. There was a randomized clinical trial, which is like the gold standard of research.
Right.
And it showed that this therapy could actually reduce pain levels and stiffness, too.
Wow. So not just masking the pain, but actually like helping the condition itself.
Yeah.
That's huge. And it's not just for arthritis, right?
Yeah.
I think I saw some things about athletes using it for muscle recovery.
Absolutely. Athletes have been using red light therapy in their recovery for a while now.
Interesting.
And now there's like the research to back it up.
Yeah.
There are studies showing that it can reduce that soreness and inflammation you get after a hard workout.
So whether you're like a weekend warrior or dealing with chronic pain, this could be a potential way to find some relief. It's starting to sound really good.
Yeah.
But I have to admit, like, I'm always a little wary when something seems too good to be true.
Yeah.
Are there downsides? What should people be careful about?
Yeah, I mean, that's a really great question. Because with anything, but especially something like this that's getting popular so quickly, you have to be careful.
Right.
It's not risk-free.
Of course.
You have to be smart about it.
Okay, so like, what are some of the risks then?
Right.
What do people need to watch out for?
Well, one of the most important things to keep in mind is that, while red light therapy is generally considered safe, you can overdo it like with anything else.
Yeah.
One study, they actually reported a case of like mild burns from too much exposure, especially with the high-intensity red light therapy.
Okay, so moderation is key.
Yes, exactly.
Just because a little bit's good doesn't mean more is better.
Exactly. It's like being out in the sun. A little sunshine is nice, but too much, and you get a sunburn.
Right. Makes sense.
It's about balance. And speaking of sunshine, we have to talk about eye protection. This is so important with red light therapy, especially the devices that use near-infrared wavelengths.
Okay, yeah. What's different about those wavelengths? Why do they matter for the eyes?
So near-infrared light, it can go deeper into the body, which is why it's so promising, right? But that also means it can reach the retina in your eye.
Oh, I see. And that's obviously not good.
No. So eye protection is non-negotiable, and it has to be the right kind, specifically designed for red light therapy. Don't just grab your sunglasses.
Okay, good to know. So it sounds like we need to be careful about overexposure and protect our eyes. Anything else people should be aware of? What about medications? I know some meds can make your skin more sensitive to the sun. Could that be a problem here too?
You're totally right to ask about that. Certain medications, yeah, they can make you more sensitive to light, things like some antibiotics or even some acne meds that can increase the risk of irritation or even burns from red light therapy.
So definitely talk to your doctor before starting red light therapy, especially if you're taking any medications.
Absolutely. Always better to be safe than sorry. They can look at your situation, consider any medications, and help you decide what's right for you.
Makes sense. Now, we can't talk about red light therapy without addressing all the big claims out there. I've seen everything from weight loss and hair growth to, like, curing serious diseases. It's kind of wild. How do we separate fact from fiction?
Oh, yeah, for sure. And that's the thing with anything new in health. There's always going to be hype, misinformation. Red light therapy is no exception. And while the research we've been talking about, it's promising,
Right.
it's still early days.
Okay.
And not every claim has solid science behind it. Not yet, at least.
So how do people listening figure out what's legit?
Be skeptical. If something sounds too good to be true, it probably is. Don't believe everything you see on Instagram or whatever. Look for good information like scientific studies, medical journals, organizations you trust. And remember, just because, like, a celebrity saying it doesn't make it true.
It's about being a savvy consumer.
Right.
Doing your research.
Exactly. And one more thing. Red light therapy, it shouldn't be a replacement for real medical treatment. If you're thinking about using it for a health condition, talk to your doctor. It's so important. It's about using it safely and responsibly, not expecting miracles.
Right.
Now, we've talked a lot about the physical stuff, skin, pain relief. But what about the mind? We touched on this a little before, but the research on red light therapy and mental health, it's really fascinating. I want to go deeper on that.
Yeah, it's a really interesting area. Definitely a lot more to learn. But there are some really cool findings that suggest this therapy could have a big impact on our mental well-being.
Yeah, one of the studies that stood out to me was about near-infrared light therapy and treatment-resistant depression. Like, we're talking people who haven't had success with traditional treatments. And they saw some mood improvements just from shining this light on their heads. That's pretty amazing.
It is. And it speaks to this potential that red light therapy has. Maybe it can help mental health in ways we don't even fully understand yet.
Right. So how does that even work?
Yes.
Shining light on your head makes you feel happier. What's going on there?
I know, right? It
Yeah.
does sound kind of crazy.
It does. But the research seems to suggest that red light therapy, it might be changing how the brain works in a few key ways.
Okay, let's break those down. What's the first one?
Blood flow.
Okay.
So we know that this therapy can improve how blood moves throughout the body. That includes the brain. And more blood flow means more oxygen, more nutrients reaching those important brain cells. And that's crucial for, healthy brain function.
So it's like giving your brain a boost.
Yeah, exactly. Think of your brain after red light therapy. It's got this boost of oxygen, nutrients. It's like a well-oiled machine. It's no wonder that studies are finding benefits like better memory, better attention, and then there's inflammation.
Right, because chronic inflammation, that plays a role in so many mental health conditions. Depression, anxiety, even Alzheimer's. And red light therapy is supposed to be good for inflammation. So is it possible it's reducing inflammation in the brain, creating a better environment for it to function?
That's exactly what researchers are trying to figure out. And if that's the case, it opens up so many possibilities because then you're not just treating symptoms, you're maybe getting at the root cause.
It's like a whole new way of thinking about treatment. Instead of just managing, we could be like changing the course of these conditions.
Right.
Imagine a future where something like red light therapy could help people with depression, anxiety, or even cognitive decline.
It's exciting. But of course, we need more research. We're just scratching the surface here. We need to understand the long-term effects of red light therapy for mental health. But so far, it's looking good.
It really does sound like we're just at the beginning with red light therapy, especially for the brain. So as we start to wrap up our deep dive here, what are your big takeaways? What's the most important stuff for listeners to remember? So it sounds like it could be really promising for a whole bunch of things, but we've also got to be realistic about the potential risks, right? We touched on a few, but what are the downsides that people really need to know about?
Right, yeah. Like we said, it's not completely risk-free.
Of course.
You've got to be smart about how you use it. So one of the big ones is overexposure.
Okay, like how much is too much?
Well, it depends on the device, the intensity of the light, that kind of thing. But there have been cases of people getting like mild burns from using it too much.
Ouch. Okay. That makes sense, though. So it's like anything else, moderation is key. Just because a little bit of red light might be beneficial doesn't mean more is automatically better.
Exactly. It's all about finding that sweet spot, not going overboard. And while we're on the topic of things to be cautious about, eye protection is absolutely crucial, especially with the devices that use near-infrared wavelengths. Those can be tricky.
Right, you mentioned those earlier. What is it about those wavelengths that makes them potentially risky for our eyes? It seems like regular red light, like from a light bulb, isn't really an issue.
So near-infrared light, it can penetrate a lot deeper. That's why it's so interesting for things like pain relief, maybe even affecting how our beams work. But that also means it can reach the retina at the back of your eye, and that's where the problems can start.
Okay, yeah, that makes sense. So we want to avoid any potential damage there.
Absolutely. Which is why the right eye protection is non-negotiable, especially if you're using red light therapy at home. And don't even think about using your regular sunglasses. They won't cut it. You need something specifically designed for red light therapy.
So we've got to be careful about overexposure, protect our eyes. Got it. What about medications? You know how some meds can make your skin super sensitive to the sun? Could that be a problem with red light therapy too?
You are absolutely right to ask about that. It's something a lot of people don't realize. Yeah, there are definitely certain medications that can make your skin more sensitive to light. We're talking about some antibiotics, some acne medications, even some things you take for other conditions. And if you're using those, you might be more prone to irritation or even burns from red light therapy.
Okay, that makes sense. So if you're taking any kind of medication, definitely talk to your doctor before trying red light therapy.
Absolutely. Always, always better to be safe than sorry.
For sure. Okay, so we've talked about some of the things to watch out for. But what about all the big claims that are out there? Like I've seen ads claiming red light therapy can do everything from making your hair grow to like, I don't know, curing cancer.
Yeah. It's a lot, right? And unfortunately, that's often the case with anything new in health and wellness. There's always going to be some hype and misinformation floating around.
Yeah.
Red light therapy, it's no exception.
Right.
And while the research that we've been discussing, it's definitely promising.
It is.
It's still relatively early days.
Okay.
And not every claim out there has solid scientific evidence to back it up. At least not yet.
Okay, so how do our listeners sift through all of that? How do they figure out what's legit and what's just like marketing fluff?
Honestly, a healthy dose of skepticism goes a long way. If something sounds too good to be true, it probably is. Don't believe everything you read on the internet, no matter how convincing it sounds. Instead of relying on like Instagram ads or whatever, look for credible information. Look for scientific studies. Look at reputable medical journals. Rely on information from trusted health organizations. And remember, just because, your favorite celebrity might be promoting a product or a treatment, it doesn't automatically mean it's effective.
Yeah, influencers are not medical experts.
Exactly.
It's about doing your research, being an informed consumer.
Yes, 100%. And one more thing I want to emphasize red light therapy. It shouldn't be seen as a replacement for actual medical treatment. It can be a great tool, it can be a great complement to other things you might be doing, but it's not a magic bullet. So if you're considering using it for a specific health condition, whatever it is, please talk to your doctor, get their input.
Yeah, that's such an important point. It's about being safe and responsible with this, not expecting miracles. Okay, so we've talked a lot about the physical benefits of red light therapy, things like skin health, pain relief, and even some potential for speeding up muscle recovery. But what about its potential impact on, like, the mind? Earlier, we briefly talked about this really interesting but still pretty new area of research looking at red light therapy and mental health. I want to dive a little deeper into that. What are your thoughts?
Yeah, absolutely. It's definitely an area that I think holds a lot of promise. And while the research is still, like you said, in its early stages, there are some really, really intriguing findings, things that suggest red light therapy. It could potentially have a pretty big impact on our mental well-being. We might be talking about new ways to address some pretty challenging mental health conditions.
Yeah, one of the studies that really stood out to me was the one on near-infrared light therapy and treatment-resistant depression. I mean, we're talking about people who haven't found relief from traditional treatments for depression, and yet there's this research that suggests that simply shining near-infrared light on their heads led to some noticeable improvements in their mood. That's, like, incredible, right?
Yeah, it really is remarkable. And I think it really speaks to the potential for red light therapy to help us approach mental health in a whole new way. We're just scratching the surface here, but what we're seeing so far, it's really promising. Like if it can help people who haven't had success with other treatments, that's huge.
It's huge.
Yeah.
So walk me through this. How does shining light on your head make you feel happier? It sounds kind of out there.
I know, right? It does seem kind of crazy on the surface. Like, can light really affect our mood that much? But there's some really interesting science behind it.
Okay, I'm all ears. Break it down for me.
So the research seems to be pointing to a few key ways that red light therapy might actually be influencing brain activity.
Okay, what's the first one?
Blood flow.
Okay, right. Makes sense. We need good blood flow for everything.
Exactly. And we already know that red light therapy can improve blood circulation throughout the body, and that includes in the brain. More blood flow means more oxygen, and nutrients are reaching those important brain cells, and that's absolutely vital for healthy brain function. It's like giving your brain a supercharge.
Right. So it's not just about like making your skin look nicer.
Yeah.
It's about potentially affecting how your brain actually works.
Yeah. Think of it this way. You do a little red light therapy, maybe on your head, maybe elsewhere on your body. It boosts your blood flow. And all of a sudden, your brain, it's got this extra supply of oxygen and nutrients. It's like, going from regular fuel to premium fuel. You're giving your brain what it needs to function at its best.
That makes a lot of sense. Okay, what else? What's another way it might be working?
Inflammation.
Right. We talked about that a little bit with the other stuff, but how does it apply to the brain?
So we know that chronic inflammation, it's not good for you, right? And it plays a role in a whole bunch of mental health conditions, not just depression. We're talking about anxiety, even more serious things like Alzheimer's disease. And, well, red light therapy, it's really good at reducing inflammation. So researchers are looking into whether it can do the same thing in the brain. Could it be that by calming down inflammation in the brain, red light therapy might actually be creating a more favorable environment for, well, healthy brain function?
Wow, so it's like hitting a reset button on your brain.
In a way, yeah. And that's what I find so fascinating about all of this. If that's true, then we're not just talking about masking symptoms anymore. We're potentially talking about impacting the underlying causes of these conditions. Imagine that.
It's like a whole different way of thinking about mental health treatment. Instead of just trying to manage, the symptoms, what if we could actually address some of the root causes, the things that are driving those conditions in the first place?
Exactly. It's a really exciting prospect and one that researchers are really eager to explore further. I mean, think about the potential. What if we could use red light therapy to help people manage their depression or their anxiety or even, cognitive decline as they age? Those are big, big deals.
Yeah. It's like opening up this whole new frontier in medicine and specifically in mental health. It's pretty mind-blowing to think about.
I know. And while it's crucial that we're cautious and don't get ahead of ourselves, we still need more research to really nail down the long-term effects of red light therapy, especially for something as complex as the brain. The early findings, they're really encouraging. There's a lot of potential here.
It sounds like it. So as we start to wrap up our deep dive into red light therapy, what are your main takeaways for our listeners? What do you really want them to remember from our conversation?
Yeah, it really feels like we're just at the beginning of understanding all of this, especially when it comes to the brain. So much potential, but also some important things to be mindful of. So for someone listening thinking, okay, this is really interesting, I want to learn more, where do they even begin?
Well, like I always say, knowledge is power, right? Especially when it comes to our health.
Yeah, for sure.
So I always encourage people to go back to the source, look at the research we've been talking about. We'll make sure to link all of those studies in the show notes so people can check them out for themselves.
Perfect. And something else we've touched on is that not all red light therapy devices are the same.
Right, right. It's a bit of a wild west out there right now.
It seems like it. So how can people figure out what's what? There's a new gadget every day, it seems like.
It's true. And unfortunately, not all of them are created equal. Some are definitely better than others. So when you're choosing a device, what should you look for?
So many things. The wavelengths they use, that's a big one. Intensity of the light is another one. And then also, what are the recommended treatment times? These things all make a difference, both for how well it works and, for safety too.
Right, because we want to make sure we're using it in a way that's actually beneficial and not going to cause any harm.
Exactly.
Okay, so Where do you even start? How do you find a reputable device? There's so much out there, so much marketing, it's overwhelming.
It really is. And honestly, this is where I always say, if you're serious about trying this, talk to your doctor.
Okay, yeah, that makes sense.
They can look at your specific needs, consider your health history, all of that. And they can help you figure out if red light therapy is even right for you, because it might not be for everyone, right?
Right.
And then if it is something you want to try, they can often point you towards good brands, good devices. Make sure you're investing in something worthwhile.
It's about making informed decisions, right? About your health, about the things you're putting on, or in this case, shining on your body.
Absolutely. Informed decisions are key. And then even once you have a device, you've done your research, you've talked to your doctor, always, always follow the instructions.
Okay, good reminder.
Start slowly, see how your body reacts.
Don't go overboard, right? Start low, go slow.
Exactly. And if anything feels off, if you have any weird side effects, stop and talk to your doctor.
Always better to err on the side of caution. Okay, so we've talked about where things stand now, but I'm curious, where do you see all of this going? What does the future hold for red light therapy? What are you most excited about?
Ooh, that's the big question, isn't it? And it's what makes this whole field so exciting. I really believe we're just at the tip of the iceberg.
Really?
Oh, yeah. As the research continues, I think we're going to see even more uses for it, maybe for things we haven't even thought of yet.
It's like we're just starting to understand the power of light.
Exactly. It's amazing and kind of mind-blowing when you think about it. For me personally, I'm most excited about the research into the brain.
Yeah, that seems huge.
It is. To think we might be able to help people with some of these really challenging mental health conditions in completely new ways, that's incredibly exciting.
It's like opening up this whole new frontier in mental health, in medicine in general.
I agree. It's really cool stuff.
Well, on that note, I think that's the perfect place to leave our listeners with a sense of wonder and excitement for what the future holds. As we keep learning more about light, about how it interacts with our bodies, who knows what amazing discoveries we'll make.
I think so too. It's a really exciting time to be following all of this.
It is. And as with anything new, information is key. So stay informed, stay curious, and don't be afraid to ask questions.
That's great advice.
Well, that's all the time we have for today's deep dive on red light therapy.
This was a fun one.
It was. A huge thank you to our expert for joining us and sharing your expertise.
My pleasure. As always, happy to be here.
And to our listeners, thank you for joining us on this journey into the world of red light therapy. We hope you found it informative and maybe even a little inspiring. Just remember, as always, this isn't medical advice. Please talk to your healthcare provider before making any decisions about your health or treatment. We'll be back next week with another deep dive on a new topic. Until then, stay curious.